Picture this for a moment. You're sitting in a quiet clinic room, the air smells faintly of antiseptic. Your doctor walks in, glances at your chart, and says something that sounds completely routine. We'll just schedule a few standard checkups. You nod, of course you do. Because that's what responsible people do, right? You follow instructions, you trust the system. You assume that every test being ordered is there to protect you. But what if I told you that after a certain age, some of those routine checkups may not be protecting you at all? In fact, some of them might quietly be setting you up for a chain of events that could take away the very independence you're trying to preserve. I know that sounds uncomfortable. It should. Because this is not something most people ever hear from their doctor. My name is Dr. Elias Rahman. I've spent more than 2 decades working with adults over 60, watching not just diseases, but decisions. And what I've learned is this. The biggest risk to your health after 65 is not always what's missed. Sometimes it's what's found. Because once something is found, the system doesn't pause. It moves, and it keeps moving. Whether that movement helps you or harms you. Today, I'm going to walk you through 4 medical checkups that I personally think very carefully about after the age of 65. Not because medicine is bad, not because doctors are wrong, but because the way medicine is applied in older adults is often very different from how it should be. Before we get into those 4 checkups, there is one idea you need to understand. Because without this, nothing else I say will fully make sense. It's something I call the domino effect. Here's how it works. You go in for a simple test. The test finds something small, not dangerous, not urgent, just something. But now that it's been found, it has a label. And once something has a label, it becomes a problem that needs attention. So your doctor orders another test. That test shows a little more detail. Now there's uncertainty, so you get referred to a specialist. The specialist wants clarity, so they recommend a procedure. The procedure carries risk. It carries risk. And suddenly, you're no longer a healthy person going in for a routine checkup. You're a patient managing multiple issues that didn't exist before the first test. I've seen this happen more times than I can count. And the most difficult part is this. It often starts with good intentions. No one is trying to harm you, but the system is designed to act, not to wait. And sometimes, waiting is the better choice. Let me tell you about someone I'll call Mr. Kareem. He was 72. Sharp mind, active lifestyle, no major complaints. He came in for a routine visit. His doctor suggested a screening, just to be safe. The result came back slightly abnormal. Not alarming, but not perfect either. That led to another test, then another, then a minor procedure. That procedure caused a complication. The complication required medication. The medication caused side effects. Within 6 months, Mr. Kareem had gone from someone living independently to someone managing fatigue, dizziness, and a fear of falling. And the original issue? It was never going to harm him, not in his lifetime. That is the reality most people are never told. So before we go any further, I want you to remember one thing. Finding something is not always the same as helping something. Now let's talk about the first checkup, and this one might surprise you. Full body scanning. It's often marketed as the ultimate peace of mind. You go in, they scan everything, and you walk out feeling like you've taken control of your health. It sounds powerful, it sounds proactive, but here's what actually happens. When you scan an entire body after 65, you are almost guaranteed to find something. Not because you're sick, but because aging bodies naturally develop small changes. Tiny cysts, minor nodules, slight irregularities. Most of these are harmless. They've been there for years. They were never going to cause a problem. But once they appear on a report, they become impossible to ignore. Now you're told, we should keep an eye on this. So you come back in 6 months, another scan, then another. Each one adds exposure. Each one adds anxiety. And sometimes something looks slightly different. Now there's concern. Now there's talk of biopsy. And that's where risk enters the picture. Biopsies are not just tests. They are interventions. They can cause bleeding, infections, complications that didn't exist before. All for something that may never have needed attention in the first place. This is where many people get caught. Because the promise of certainty pulls them in. But what they get instead is a cycle of monitoring and worry. So the question you need to ask is not, what might we find? It's, do I have a reason to look in the first place? If there are no symptoms, if nothing feels wrong, then you need to think very carefully about whether looking deeper actually serves you. Now let's move to the second checkup. Bone density testing later in life. This one is a little more nuanced. Because earlier on, it can be very useful. It can help identify risk. It can guide prevention. But as you get older, especially into your late 70s and beyond, the situation changes. Because the result almost always leads to medication. And these medications, while helpful in some cases, are not without consequences. Some can affect the way your bones remodel. Some can increase the risk of unusual fractures over time. Others can create issues with dental health that are difficult to manage. But here's the deeper issue. A number on a scan does not cause a fall. Balance does. Muscle strength does. Vision does. Medication side effects do. So if the focus becomes treating a number instead of improving stability, you may be solving the wrong problem. I've worked with patients who spent years trying to fix their bone density while never addressing the actual factors that determine whether they fall. And falling is what causes fractures, not the number alone. So before agreeing to repeated bone density testing later in life, ask a simple question. Will this result change what we do in a meaningful way? If the answer is unclear, that's your moment to pause. Because not every measurement needs to be chased. Some need to be understood in context, and that context is your life, not just your scan. Now, the third checkup, and this one is more common than people realize. Screening of blood flow in the neck. It sounds important. It sounds preventive. You check the arteries, make sure everything is flowing properly, reduce the risk of stroke. That's the idea. But here's what most people don't realize. In people who have no symptoms, no warning signs, no history suggesting a problem, finding a narrowing doesn't always lead to a better outcome because the treatment itself carries risk. And in some cases, that risk can be equal to or even greater than the problem you're trying to prevent. So now you're in a situation where knowing more doesn't necessarily protect you more. It just gives you a decision that may not improve your future. And that's the pattern I want you to start noticing. More information is not always better. Better decisions come from the right information, at the right time, for the right reason, not just more data. And this brings us to the fourth checkup. But before I explain it, I want you to think about something. How many times have you agreed to a test simply because it was recommended, without asking what happens next, without asking what it leads to? That habit is what we're about to change. Because the fourth checkup is where everything we've talked about comes together. And it's also the one that has the greatest potential to shift your health in the wrong direction if you're not careful. We're going to break that down next. But more importantly, I'm going to show you how to protect yourself from the chain reaction that so many people fall into without ever realizing it. Stay with me. Now I want to show you something that almost no one talks about, but it might be the most important part of this entire conversation. Because by now you might be thinking, so should I just stop getting tests altogether? And the answer is no. That would be just as dangerous as blindly agreeing to everything. The real issue is not the test itself. It is the timing, the purpose, and the consequence of what happens after. Let me explain it in a way that will stay with you. There are two types of medicine. There is medicine that helps you live longer, and there is medicine that helps you live better. When you are 45, those two things are often the same. When you are 70, they are not always aligned anymore. And that is where most people get misled, because the system is still operating as if every test is about extending life at any cost. But for many older adults, the real goal is not just adding years. It is protecting independence, mobility, clarity, and quality of life. And sometimes the wrong test threatens all of those. I remember a man I will call Victor. Victor was 76 years old. He was not sick. He walked every morning, played with his grandchildren, handled his own finances, drove himself everywhere. Played with his grandchildren, handled his own finances, drove himself everywhere. He described his life as simple but good. During a routine visit, his doctor suggested a screening that led to another test. That test showed something borderline. Not dangerous, not urgent, but not perfectly normal either. So they recommended a procedure. Victor agreed. The procedure went fine. But afterward, he developed a complication. It was not life-threatening, but it changed everything. He became afraid to move the same way. His activity level dropped. His confidence dropped. Within a year, he needed help with things he used to do effortlessly. And the hardest part, the original finding, was never going to harm him. The original finding was never going to harm him, not in his lifetime. What changed his life was not disease. It was the process of chasing something that did not need to be chased. This is what I mean when I say not every finding deserves a reaction. And this brings me to something even more important. Because once you understand this next concept, you will never look at medical decisions the same way again. It is called competing risk. Here is what that means in simple terms. As we age, the number of possible things that could affect our health increases. But our time and energy do not. So every decision has to be weighed not just against the problem it might solve, but against everything else that could realistically happen in the same time frame. For example, imagine a test that detects a slow-growing condition that might cause problems in 15 years. That test might make perfect sense at 50. But at 75, the question changes. Not, can we find it? But does finding it actually improve my life from here forward? That is the question almost nobody asks. And yet, it is the one that matters most, because medicine is very good at finding things. It is not always as good at deciding when to leave them alone. Now, let me give you something practical. Because I do not want you to walk away from this conversation feeling uncertain. I want you to feel equipped. From this point forward, there are 3 questions I want you to ask before agreeing to any test, not just one, 3. And these 3 questions will protect you from most unnecessary medical cascades. The first question is simple. What happens if we do nothing? Not in theory, in reality, what is the actual risk of leaving this alone? Is it 1%? Is it 10%? Is it something that might never affect you? You deserve a clear answer. The second question, what are the risks of finding something? Not just the test itself, but everything that comes after. More scans, more procedures, more medications, more side effects. More scans, more procedures, more medications, more side effects. Because the test is never just the test, it is the beginning of a path. And you need to understand where that path leads before you step onto it. And the third question, how will this change what we do next? This is the most important one. If the answer is unclear or vague or hesitant, that is your signal to pause. Because a test without a clear action plan is not prevention. It is uncertainty. And uncertainty in medicine often leads to overreaction. Now, I want to talk to you about something else that rarely gets discussed. Fear. Because fear drives more medical decisions than most people realize. Fear of missing something, fear of regret, fear of what if. Doctors feel it, patients feel it, families feel it, and that fear pushes people toward doing more. More tests, more procedures, more interventions. But more is not always better. In fact, sometimes more is exactly what causes harm. The safest decision is not always the most aggressive one. It is the most informed one. Let me say that again. The safest decision is not always the most aggressive one. It is the most informed one. I had a patient who once told me something I will never forget. She said, "Doctor, I thought saying yes to everything meant I was taking my health seriously." But what she learned over time was this. Taking your health seriously does not mean agreeing to everything. It means understanding what actually benefits you and having the confidence to say no when something does not. Now let me bring this back to you, because everything we have talked about only matters if you use it. The next time you sit in a doctor's office and someone recommends a test, pause. Not out of resistance, not out of distrust, but out of awareness. Ask your questions, listen carefully to the answers, and give yourself permission to think. You do not have to decide in that moment. You can go home. You can reflect. You can even seek a second opinion. That is not being difficult. That is being responsible. Because this is your body, your time, your life, and no one will ever be more invested in it than you are. Now, I want to leave you with one final thought. The goal of medicine is not just to help you live longer, it is to help you live well. To wake up in the morning and feel capable. To move without fear. To think clearly, to remain independent, to enjoy the life you have built. Every decision you make about your health should support that goal, not quietly take it away. So remember this, before any test, before any procedure, before any decision, ask yourself one simple question. Will this help me live better or just do more? Because those two things are not always the same. And knowing the difference might protect you more than any test ever could. Now I want to hear from you, which part of this surprised you the most? Was it the idea of the cascade? Was it the risks behind certain routine tests? Or was it realizing that you are allowed to question what is recommended? Tell me in the comments. I read every single one. And if this gave you a new way to think about your health, share it with someone you care about. Because one conversation, one question, one pause at the right moment can change everything. And that is not an exaggeration. It is something I have seen with my own eyes. Take care of yourself and make your next decision an informed one.